Severe bleeding is a medical emergency. It can become life-threatening in just minutes, so it's important to act quickly and confidently. You can usually recognize emergency bleeding if the blood is spurting or flowing heavily, if the wound is deep or large, if blood soaks through clothing or bandages, or if the bleeding doesn't stop after a few minutes of direct pressure. If you see any of these signs, call 911 immediately or ask someone nearby to call for you. While help is on the way, begin first aid right away. Put the phone on speaker so the dispatcher can guide you until professionals arrive. If you have gloves or any kind of barrier, put them on to protect yourself. If not, try to use a clean cloth or plastic bag, but don't let the lack of gloves stop you from helping. Apply firm, direct pressure to the wound using a clean cloth, gauze, or even your hand if nothing else is available. Press down directly on the wound and don't let it up to check if the bleeding has stopped. Keep the pressure steady until help arrives or the bleeding slows significantly. If the cloth or bandage becomes soaked with blood, don't remove it. Just place more layers on top and continue applying pressure. If the injury is on an arm or a leg, and you can do so safely, gently raise the limb above the level of the heart. This can help slow the flow of blood. In situations where the bleeding cannot be controlled by pressure alone and is clearly life-threatening, a tourniquet may be used, but only if you're trained. A tourniquet should be placed above the wound 2 to 3 inches between the injury and the body. Keep in mind that improper use of a tourniquet can cause serious harm, so this step is only for extreme cases when nothing else is working. If a tourniquet is applied, do not remove it until medical professionals arrive. While you work to control the bleeding, keep the person as calm and still as possible. If they look pale, feel faint, rapid breathing, or seem cold or confused, lay them down and keep them warm. These could be signs of shock, and staying calm and supported will help until emergency responders arrive. If shock is a consideration, cover them with a warm blanket or other material if available. Don't try to clean the wound, and don't remove anything deeply embedded. If there's an embedded object, place the cloth or dressing around the object and apply pressure. In severe bleeding emergency, your main goal is simple: control the bleeding and get professional medical help as fast as possible. Severe bleeding is serious, but with quick action, you can make a life-saving difference.